Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guest who is from a fascinating company. He's a fascinating guest, to say the least. The company is called GeneKey, and you'll learn more about what that actually means in a moment. The company is headquartered in Palo Alto, California. I'd like you to meet our guest now. He's here on my left, Dr. Raphael Lehrer. He is the founder and the CEO of GeneKey, and he is a PhD in physics. Dr. Lehrer, welcome. Nice to have you with us. Let me ask you, before we begin, and this is really such a fascinating subject, and especially the way you focus on the treatment of cancer. But a little while ago, you had a chance to answer some questions from William Shatner. Let's take a quick look and see how a portion of that went. Then we'll continue, okay? Here he is with William Shatner.
Good to have you here. I'm very concerned about health care. The real issue is, how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing, move America forward?
Mr. Shatner, we're taking on cancer one patient at a time. We empower cancer patients and their doctors to develop targeted treatment strategies based on the biology of their individual tumor. That, Mr. Shatner, is how we're helping to move America forward.
That's really fascinating. You told Mr. Shatner that you have created a way to personalize someone's cancer treatment. What do you mean by that? How do you personalize a treatment?
Well, when you find out you have cancer or advanced cancer, it can be, a bit scary and frightening. And what you try to do is you try to, most people try to learn everything they can about the disease. And what we're doing is really taking that to the next level. We're essentially conducting a deep scientific research study on the individual patient.
And on their tumor.
And on their tumor.
So how do you do that? What do you do?
Well, we start with, tumor material from a biopsy. Usually that's the biopsy that they already have. Right. What we do is we generate data from it. Typically, that we look across the whole genome. That's tens of thousands of genes across multiple technologies, multiple ways of looking at the genome. And then we put them together and try to understand what's different between their tumor and their normal. There are thousands of differences, as it turns out, usually between the tumor and the normal, so it becomes a little bit complicated, a lot complicated. And so what we do is we look at the various functions involved in biology, whether or not they're already known to be related to cancer, because there are so many drugs that are used that were not for cancer, that were not originally cancer drugs.
That was something I was going to get to, but this is a great opportunity to point out the fact that you're talking about the genome and genes. This is where the name of the company comes from.
That's right.
GeneKey.
That's right.
G-E-N-E is the way you spell it. So, and incidentally, I didn't mention that you are a Harvard-trained physicist.
That's right.
And you have been specializing in this area. It's Dr. Raphael. Dr. Raphael Lehrer. We'll get to Raphael.
Yes.
Yeah. This is an amazing subject. The question comes up: are you doing things that others in the field of cancer treatments are not normally doing?
Yes. Personalized medicine has moved forward a great deal in the last few years, and oncologists have really started to embrace it. Yeah. What that usually means is looking at a couple of genes, a couple of tests. It varies a bit, and maybe at the the best institutions you get a little bit more. But across the whole genome, I would say there are some studies being done, but nothing really looking at the individual patient and trying to understand the biology of the individual tumor and what's really driving it.
And the key, the bottom line is, in looking at all these 20,000 different tests that you're running, or at least the tests on 20,000 different genomes, are you learning things sometimes that really help change the course of treatment for the patient?
Yeah. I mean, in about 90% of the cases, we are finding we are finding something that is new to the oncologist, a therapy that they would not have considered for that cancer.
How do the doctors, the individual doctors, oncologists, react when you're brought in to assist in the case?
Well, we have a call with the oncologists up front to discuss the methodology and that. And while oncologists can be rightly skeptical of novel treatment approaches, in the first 5 minutes of a call, every oncologist that I can remember has recognized that this is excellent science, and has been happy to collaborate with us. Then after we're done with the analysis, we go and we meet with the oncologist and the patient, we point to what we found, and the hard evidence and the references behind them. We basically produce what looks like a journal article. It is a scientific journal article, right, just on one patient.
Right. Who gets you involved? Where does it begin?
Typically, the patient contacts us first. Sometimes the oncologist, usually the patient. Some of our patients have been oncologists themselves, actually.
Really?
Yeah.
Really? There, and as you were talking, I was thinking here, you're really searching for drugs that can help, and oftentimes these are drugs that heretofore have not been utilized in the treatment of cancer.
That's right. So, that's right. There are a lot of drugs out there, and more being discovered every day that have cancer uses.
Can you give me an example of what you're talking about?
Sure. Let's take thalidomide, for example,
Wow.
which is a drug that's obviously was used for something else, but it's found new life in multiple myeloma. And so there are lots of things that are outside of cancer that are being discovered, and using this technology, we're able to identify them sometimes well in advance of the medical field.
Let's take a look at what you have on the laptop there. Explain to me what this is. You may want to tilt it up a little more straighter there. Okay, so our camera can get a good shot at it. What is this?
This is an example of a pathway, a function that's in a colon cancer patient in this case, and this is one of hundreds that we look at, and in this case, it was something that we found was implicated in the disease. This has to do with cell division. There are a number of ways to get at this, which we ended up talking about with the oncologist. There are platinum drugs, which is a traditional colon cancer drug, and but that's susceptible to resistance at this gene here, P53. There's often a mutation, right, which in this case was causing resistance to the platinum drugs. So then there are a few other approaches, and this is just a handful of them. One is clinical trials, CDK inhibitors. There are a number of trials all around the country studying those. Statins have been implicated in this pathway, helping to shut it down. Zocor has been particularly studied in that. And here's resveratrol, which is an extract from red wine, which also, from the studies, appears to be effective here.
Interesting indeed. In addition to, I'm amazed to hear resveratrol mentioned there, because you see it advertised, as from red wine. It could possibly have an effect on cancer. It's good for you to drink that, so that it really may play a key role in it in certain parts.
Well, there are a lot of supplements for which there have been scientific studies, and we rely on those.
I was just going to get to that. Supplements and natural products.
That's right. And so we're dependent on the science here. So when there are scientific articles that have shown how these supplements are working in the cell, then we're able to pull from them, like resveratrol here. Mm-hmm. And that's a field that's always growing.
I'm tempted to ask you. I don't know if you do follow-ups on the cases, but do you follow the patients to see how these treatments work and help
Absolutely.
them?
And we continue to be involved in decisions as the case progresses.
Right.
Helping the oncologist and the patient, make.
I would also assume that when people get you involved, they're really seriously ill. Am I right? This is not early on.
Originally when we started, they were very, very ill patients, and now it's become. Earlier. It started earlier, and it is fairly serious cancers. Basically, when you are speaking to the oncologist and you don't like the prognosis that you're getting, that might be a good time. Often that's if a cancer recurs or is metastatic or is likely to be a problem in the future, come back. I speak to a lot of people who are actually doing okay now but have a poor 5-year prognosis.
This must be very satisfying to be involved in, I would think.
You know, when I speak to oncologists in that call, the comment I get pretty often is, this is the future of medicine. So, I think as we go forward, I see more combinations that we're able to work with on the oncologist, and those combinations, because they're able to hit a cancer in multiple different ways at once, may well present resistance, may lower the chance of recurrence, and may have a, may be able to. I don't like to speculate on getting rid of it, but yes, it may.
Conceivable. But in addition to that, you are helping to come up with new ways to treat cancer.
Well, that's right. And we're often in advance of the medical literature on that. And what works for one patient probably works for another patient out there somewhere.
Somewhere down the road.
And so it's a question of identifying.
Dr. Lehrer, it's really been a pleasure talking with you. It's fascinating what you're involved in. Congratulations and good luck, and keep going here.
Oh, thank you very much.
Okay.
Thank you very much. It's a real privilege.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Dr. Raphael Lehrer, the President and Chief Scientist at GeneKey Corporation, for the outstanding work he is doing to help keep America moving forward. The website, by the way, for the company is GeneKey.com. Doctor, congratulations.
Thank you very much. I want to thank the entire GeneKey team. I mean, we really couldn't do this without it, and also the patients and the oncologists. It's really been a privilege to work with them and to try to help their care.
Thank you and congratulations.
Thank you.